What is anaplastic large cell lymphoma, ALCL? Imagine a rare type of lymphoma that originates from a specific kind of immune cell called T cells. That's what anaplastic large cell lymphoma is. It is classified as a non-Hodgkin lymphoma, which means it starts in lymphocytes, a type of white blood cell that helps fight infections. ALCL is quite uncommon and can appear in different parts of the body because T cells are found throughout the lymphatic system, which includes lymph nodes, organs, and tissues. This lymphoma is characterized by large, abnormal lymphoid cells that often express a protein called CD30 on their surface. These cells look different under a microscope compared to normal lymphocytes, which helps doctors identify ALCL. The disease can behave differently depending on its type, which is important for understanding treatment and prognosis. There are three main types of ALCL. The first is primary cutaneous ALCL, which affects only the skin. It appears as raised, red lesions or tumors that might itch or develop into sores. This type usually has a better outlook because it stays localized to the skin. The second type is systemic ALCL, which involves lymph nodes and can spread to other organs like the lungs, liver, bones, or abdomen. Systemic ALCL is further divided based on whether the cancer cells produce a protein called Anaplastic lymphoma kinase, or ALK. ALK-positive ALCL occurs when the cancer cells produce an abnormal ALK protein due to a genetic change. This form is more common in younger people and tends to respond well to treatment. ALK-negative ALCL does not produce this protein and is more often seen in older adults, with a somewhat less favorable outlook. The third type is breast implant-associated ALCL, which is rare and develops in the scar tissue or fluid around textured breast implants. It usually causes swelling, pain, or a lump near the implant and is often caught early because it stays confined to the breast area. Symptoms of ALCL depend on the type and where it is located. Common signs include painless swelling of lymph nodes in the neck, armpit, or groin. Some people may experience fever without infection, night sweats, unexplained weight loss, or extreme tiredness. Skin-related symptoms like rash or raised lesions are typical in skin-specific ALCL. In cases related to breast implants, symptoms often include swelling or pain near the implant. When the disease involves other organs, symptoms can include cough, shortness of breath, abdominal pain, or bone pain. The exact cause of ALCL is not fully understood, but it involves genetic changes that lead to uncontrolled growth of T cells. Some risk factors include immune system conditions or infections like HIV. In the case of breast implant-associated ALCL, chronic inflammation caused by the implant is suspected but not yet definitively proven. Diagnosis involves a biopsy of the affected tissue, with tests to determine if the cancer cells produce the ALK protein and other markers. Treatment options depend on the type and stage of the disease and may include chemotherapy, targeted therapy, radiation, or surgery, especially for the breast implant form. In summary, ALCL is a unique type of T-cell non-Hodgkin lymphoma with different subtypes that vary in how they present, how they respond to treatment, and their outlook. It's a complex disease that requires careful diagnosis and management by healthcare professionals experienced in lymphoma care. If you or someone you know is concerned about symptoms or risk factors, it's essential to consult a healthcare provider for personalized advice and appropriate testing.